you can imagine in the not too distant future, every patient can be far more confident that they're going to be getting the right diagnosis as fast as possible, and it will be tied to the right therapeutic recommendation.
Welcome to Unnatural Selection, a show about competition, innovation, and the strategies shaping tomorrow's frontiers. I'm Nick Encina. Each week, we speak with pioneers shaping the future.
This is episode 11, produced in partnership with Mass General Brigham's World Medical Innovation Forum. Today, we explore how artificial intelligence is transforming one of medicine's oldest and most trusted tools, the microscope. PathAI is applying deep learning to analyze pathology slides faster and more precisely than ever, enabling quicker diagnoses, more targeted treatments, and a new era of personalized care. Pathology sits quietly at the foundation of cancer care. When diagnoses are slow or inconsistent, everything downstream is affected. In this episode, we explore how machine learning is being used to strengthen accuracy and trust in diagnosis, and why confidence in the data itself becomes the real advantage. Our guest is Dr. Andy Beck. Andy earned his MD from Brown Medical School and completed residency and fellowship training in anatomic pathology and molecular genetic pathology from Stanford University. He completed a PhD in biomedical informatics from Stanford University, where he developed one of the first machine learning-based systems for cancer pathology. He's been certified by the American Board of Pathology in anatomic pathology and molecular genetic pathology. Prior to co-founding PathAI, he was on the faculty of Harvard Medical School in the Department of Pathology at Beth Israel Deaconess Medical Center. He has published over 110 papers in the fields of cancer biology, cancer pathology, and biomedical informatics. Let's go.
Andy, welcome to Unnatural Selection.
Thank you. Pleasure to be here.
As I always start with the same question, just to level set and give the listeners a sense of what it is that you do and your company does. So, Andy, could you please, in simple way, answer what business are you in and what is your role within that business?
Sure. So I'm the CEO and co-founder of PathAI. We build a digital pathology and artificial intelligence platform for applications in pathology, serving both drug development as well as diagnostic pathology.
So, for those unfamiliar with the space, can you give us a layperson snapshot of what PathAI does and what makes its approach unique within pathology and AI?
Sure. So, for a bit of background, the field of pathology is responsible for the diagnosis of disease. The subtype of pathology that we work in is anatomic pathology, which is the part of pathology that deals with analyzing tissue specimens. So, when biopsies or surgical resections are removed from patients, they're sent to the pathology lab. And then whether that's for drug development or for clinical care, the job of the pathology lab is to both accurately diagnose that tissue specimen. Does it contain disease? Yes or no. If it does have disease, what is the subtype of disease? And ideally, if it's a subtype of disease that is known to have a therapy that's effective for, to recommend a specific treatment for that patient to ensure that they get the right diagnosis and get recommended the right treatment that will be the most effective way for them to manage their disease. In the side of research and drug development, there's often additional information that's useful that we can extract from the tissue, including quantitative information about the disease state that can be used to help us better understand disease and to provide new hypotheses for better ways of preventing or treating disease. So, what we do is the sort of very traditional way that pathology has been done has been that a tissue specimen is sent to the lab, and a thin piece of that tissue is then applied to a glass slide. And then those glass slides are just analyzed under a microscope by a physician. Um, where the field is going is that instead of just having pathologists analyze slides under a microscope, those images will be captured digitally through what's called whole slide imaging, basically taking a very large picture, microscopic picture of that tissue specimen. So the tissue is stained and then put into this whole slide imaging machine, which is sort of like a microscope inside of a big box that then not only magnifies the image, but also digitizes it. So it takes a digital picture, which then is sent to the cloud, where our platform then ingests these whole slide images. So that's really the beginning of where our platform and products start applying. So they take as input these whole slide images, these very large pictures, and then analyzes those pictures to provide either diagnostic information or information to support drug development.
When it comes to changing the paradigm of how healthcare was done, and you talked about that just now, pathology has historically been a field of microscopes and manual interpretation. So, what are the some of the entrenched assumptions that you're challenging, and what does it take to get pathologists and regulators on board?
Sure. So I would guess the biggest on the diagnostic side, and you mean more for diagnosis? Maybe we should start there
Yeah.
than the sort of drug development side. Um, well, the biggest assumption that we're challenging, or to your question about competition, which we haven't covered, but I think it's essentially the same predominant answer, is the status quo. And the status quo is the way things have been done for, say, 50 years, is glass slides and microscopes being the core technology that's used in the lab, that the pathologist is sort of sitting next to the microscope, interpreting images, and then putting the diagnosis into the laboratory information system, which is already computational and digital. But that first piece really isn't. It's manual, it's a microscope, and it's interpreting images which are not being captured digitally uh, for perhaps something like 90% plus of the glass slides that are being reviewed every day. So I'd say that being good enough is the core thing that we think will change, because we think there's going to be enough advantages of going digital, and then on top of that using AI. But I think proving that out is the biggest, job we have to do. And then first proving it, and then really enabling successful implementation of this digital transformation, and then use of AI on top of that. So, but I would say, yeah, that's the biggest sort of practice of medicine assumption that is going to be important to change.
And you mentioned that you're building at the intersection of AI and medicine, two fields with very different timelines and intolerance for risk. How do you manage the tension when scaling new products or really innovating at the pace of technology that AI can lead you to, but then obviously adoption in healthcare is a very different timeline?
Maybe yes, maybe no. I mean, AI's been around a very long time, right? It's been very bad
Hmm.
for the beginning, and it's gotten much better the past few years. But I would say people have been trying to do AI for maybe 80 years or so, um, with fairly little success up until, say, the past 5 years. So, in terms of timelines, I mean, I don't totally agree with the premise of the question. I mean, medicine's changing all the time. You look at, like, pick up, the New England Journal of Medicine comes out every week, and there's new practice changing advances that literally aren't published, say, in that journal, or there's a few others sort of that are at that level. But unless they're practice changing, and there's practice changing advances happening all the time, so medicine actually moves very fast in certain areas. But there's a certain amount of evidence, and your point, there's a certain benefit risk trade-off that you need to hit to change medicine, and the only thing you have to do is prove that this is better than the standard of care. So there's actually is a total framework built into the whole system for how it changes, and it changes quite rapidly. If something proves beyond a doubt that it's more effective and safe, like, bam, that will happen. So I think in a way medicine's quite set up for rapid change. But the hard thing is it's changing, so it gets harder to then prove that the next change is better than the current status quo. So to some degree, I think medicine intrinsically is built for improving. Um, and AI is also built for improving. And I'd say AI has been around for a long time, and only recently has it actually gotten rapidly better. Decades went by where it didn't get much better. Um, and there have been some huge technical advances, I'd say, particularly this past decade, that have made it tremendously get better. So how do you actually change medicine? Well, you have to prove that the intervention you're making is going to be significantly more effective than the current, and that's either through improved quality or improved efficiency, are kind of two of the biggest things we think about for patients. Um, So I would say AI is one tool, but the important thing is to think about how medicine changes, and to not think about the AI. Like AI is just one tool, and it's a tool that doesn't exist by itself. It's a tool that exists into then products that you create, and then products could turn into, say, in our case, diagnostic products. And then you really have to evaluate that diagnostic product. And medicine has a real track record or history for how they evaluate or how the field of medicine evaluates diagnostic products. You have to prove that it's accurate and that it's effective. And I think the beauty is AI really does make diagnostics that can be more accurate and more efficient and be cost effective. So I actually think there's a tremendous alignment between the two, and not like they're coming from different worlds. But when you're training an AI model, you're evaluating what's the sensitivity, what's the specificity, and things like machine learning are designed to get better over time with more data. Changing medicine requires the exact same thing. That you have to prove that the sensitivity and the specificity and efficiency are better with this approach than the current approach. And then if you're able to prove that, and can do it in a cost-effective way, then that will be incorporated into the practice. So I think surprisingly in a way, I think they're quite well aligned.
I do agree. I mean, I guess it's all relative. I was thinking really in terms of a startup. Innovation at the pace of a hospital system is one thing, at the pace of a startup is very different. And I've started companies before, and I know that when you're in that ramp up phase, innovation can happen daily, at latest weekly, and hospital systems typically can't absorb innovations at those scales. And so that's why I was thinking, how much do you put the foot on the gas on what you can do and what AI can do today versus 6 months from now,
Yeah.
versus how much you have to hold it back because the hospital systems you're selling into can only take so much.
Yeah. Yes, I agree that the sales cycle and the change management cycle at hospitals can be relatively slow. I would also totally push back on the idea that innovation happens daily or happens particularly fast. I guess it's like innovation of what? Like certain things can happen fast, but creating products that are significantly better than existing products is like hard and does not happen daily. I think it takes in many cases, it takes millions of dollars and months, if not years, to both get the actual product built, validated, analytically validated, then clinically validated. In many cases, there's regulatory proof that you need for certain clinical use cases. All of that has to be done. Then you have to figure out the pricing. That stuff takes time. I don't know. I feel like that's in a way like the integration into clinical care happens on the order of months, or the sales cycle will always happen. Those are like solvable problems. And it's just it's like in a way administrative. And that stuff will happen if the product exists and you have, particularly if you have the business model for it. So yeah, we have not been necessarily, that has not been, in our opinion, the biggest barrier is like the pace of change at hospitals. Because I think if you build the right product, and especially if you have the right incentives for the hospital to utilize that product, like they will absolutely, I think, do it relatively quickly. I think building that product and building the evidence, to me, those are the things that take time and significant investment.
Yeah. You mentioned a couple things in there. Obviously, business model and product innovation. What would you say are some of the biggest differentiators between PathAI and other players in the AI pathology or digital diagnostic space? When we look at, you can innovate across a bunch of different vectors: strategy, systems, experience, business model,
Yeah,
features. Um, where do you think you and PathAI lean in the most that
yeah,
differentiates you?
it's a great question. So we've done all of those areas over the years. So we've been at this. I mean, we're 9 years into it, heading into our 10th year. I think we've never been in a stronger position, and we've certainly innovated in all of these different areas. What do I think has actually mattered for us, sort of getting to where we are? Like some of them have worked, some of them hadn't. We've had many different competitors over the years. I still think the biggest competitor still is status quo. I mean, still the biggest thing is. At least on the diagnostic side, many labs haven't yet really fully gone digital. So that's going to happen because the technology to do that exists. And I would say that's still the vast majority of the market is just still open for our technology. And then the AI products don't exist yet. We're building them, and I think we're leading. And like, So we're not like it's not like we're competing against some existing product for the vast majority of the time. It's like the products that I think should be built don't yet exist. We're building them, and I hope they're implemented. So I feel like our top competitors are still status quo in the fact that the what I think will be the most transformative products are still being built right now. And certain products do exist and certain products have competition. So it's not like I'm saying they don't, but I would just say like it's not like there's a single one, there's many different ones. So to your question of what's differentiated PathAI over the years from competitors in our space or other startups like us, of which there have been, probably dozens since we've started. One is timing the market. So you really have to meet the market where it is over the next 6 months. So I'd say one mistake people make is they tend to be late or early, and you really like timing is very important. I think we've done a very good job on timing, and what we did there was first we focused heavily on like the area of drug development that was ready to incorporate digital pathology and AI at scale, like when we started. So our very first project was like a very mature project with Bristol Myers Squibb, and then we quickly did one with Genentech, one with Gilead, which had to do with analyzing on the order of tens of thousands of clinical cases from completed clinical trials to better understand using digital pathology and AI why patients responded to therapies across different therapeutic areas, including oncology and NASH, were two of our very big therapeutic areas, and they were like great partners to be working with. So I'd say like the one thing we did very well was just like focus on that and then scale that up and really show that this should become the standard. I think it largely has become the standard for translational research in drug development, and we're one of the leading companies. And of course, there's other companies doing it, but in terms of what differentiates us from the other digital pathology companies in the areas, it's we've always stayed ahead. So although we started there and started scaling there, we fairly quickly said, okay, if this works for translational research, it's also going to work for prospective clinical trials. And we built the whole platform for supporting prospective clinical trials. And then in terms of meeting the market where it is, we didn't just build like an algorithm or show that you can take an algorithm and AI from translational research and move it into trials. We built a platform that could also support just manual scoring without AI. And like the biggest part of our early growth in that area was digital pathology without AI, but using this sort of GCLP, like regulatorily and compliant cleared platform that you could use in prospective trials. And I'd say we did that years ahead of others and then became a very, I'd say, leading platform in that area. In terms of meeting the market where it is, we also acquired our own laboratory so we could do the whole end-to-end pathology where all they had to do was send us tissue and we processed the tissue, we digitized it, and then we used our platform, our digital pathology platform. And in certain cases used AI, in certain cases didn't use AI. And then we also kind of the next cycle of progression is if you're in clinical trials, and you want to actually be used for drug approvals, you then have to be able to do companion diagnostics. So we signed a major companion diagnostics agreement about a year ago that made us one of the major partners with all of major biopharma because we're partnered closely with the leading assay manufacturer for companion diagnostics. And we're kind of like the digital AI platform that sits on top of the wet lab assay. And then in terms of meeting the market kind of where it is and getting the timing right, we then about 4 years ago or so started building our platform for diagnostic use. And we wanted to build the leading platform to do both the AI piece, but also just the workflow and the efficiency. And I think that has been very, very important. And we're now seeing significant growth there. So a lot of it is just thinking about where's the market going and don't be behind, but don't get too far ahead, and then really meet the market where it is. Like you want the demand where, so for us, it's been not only being AI, but also being a digital pathology workflow platform. And I think what we've done very well with our customers is this sort of making the feedback loop between customer feedback and product iteration as short as possible. And that allows us to sort of provide better solutions and outcompete early startups who don't have any customers. Because when you don't have customers, you may think you're being innovative, but like you're usually being innovative along the wrong axes. Unless you're doing something like drug development, where it's super clear what an effective product's going to look like. Like if you cure cancer, that product's going to be highly successful. But for like technology, services, software, where you have users, it's very hard to abstractly know in many ways what the best product's going to look like until you start working with customers and iterating quickly. So I'd say we did that in drug development, and we've certainly done that really well on the diagnostic side. And startups with no customers have trouble doing that. And then big companies are just not fast enough usually. So, particularly in healthcare, it seems like you don't have these, like, big tech companies, even humongous ones like Meta and Instagram. They're very good at responding quickly to customer feedback. Whereas a lot of the big manufacturers in healthcare are just like very, very conservative, and their product development cycle, it might be like one product every 2 or 3 years. So they don't move as quickly. Their software is less an important piece of it. But we've been very good at, I think, getting customer feedback, incorporating it into six week release cycles of software. And I think that's helped differentiate that. So I know that was a lot of different answers, but it was a question of timing, business model, kind of seeing where the market is today and where it's going over the next 6 months. And I think we got many things wrong, but we got some of those things right.
No, I love it. And you mentioned the PathAI has been around for 9 years, so you've obviously seen this market evolve, or the
Yeah.
opportunities. It's not just a single market. So if we think about, like you said, you're meeting the market where it is, looking ahead the next 3 to 5 years, where do you expect the greatest growth for PathAI to come from? You mentioned clinical diagnostics, pharma
Yep.
partnerships, international
Yep.
markets, or is it something else?
No, I think it's that. I think you're right. I think on the pharma side, where we see it growing the most is going from sort of a pharma has a few different areas. They have like early research and discovery, which to some degree is where we started more, but where you're not yet really tied to like the registration, like the approval of a new therapy. And then they have late stage clinical, early stage and late stage clinical development, and then on market. So where we're moving more in pharma is to really decrease the distance between the discovery of a new biomarker and then the implementation of that, like in a prospective trial that could lead to a companion diagnostic. So I would say the biggest area of development there is like, how do you go really fast from translational research to a new companion diagnostic? And we're seeing that interest and then using AI as that accelerant. So you discover something new from existing data and you very quickly have a product development cycle to build that into a new companion diagnostic. That's like the area of pharma where I think AI and agentic systems and digital pathology will be really key over the next, say, 3 years, where those historically have been fairly siloed. Um, and then I think there's also maybe I'll give three examples. Two of them pharma, starting and ending with pharma. So one is sort of like going from R&D to companion diagnostic. A companion diagnostic is called that because it's a direct companion to the new therapy. So you need it both for the approval of the therapy, but also for the commercialization of the therapy, getting it to patients. Well, if digital pathology is a piece of it, the only way you get it to patients is if digital pathology and this platform is widely distributed. And then I think clinical and diagnostic labs is a huge growth area. I think AI is gonna play a huge role there, just because as we're seeing in all areas of our life, for certain tasks that AI is good at, it's just getting better and better and automating more and more of that task. So, I'd say where we started was algorithms did very, very specific things very, very well. Like if a pathologist diagnoses cancer and it's a cancer that needs a test called immunohistochemistry, and the way you evaluate immunohistochemistry tests is by counting the number of brown cells. So we would build an algorithm and validate it to count the number of brown cells, and it would work very well. But the truth is, with these new AI systems and things we've built and others are building, it can do all of those things. So basically, you want all of that work done for the physician before they even sit down. So you can imagine a complex case coming through. The AI system is reading the priors, reading the electronic health record, reading all the slides, interpreting, putting all that data together, thinking about it, looking at the literature, and then creating a diagnosis, doing whatever downstream biomarker tests need to be done. So then, like when the pathologist sits down, all of that data is waiting for the physician, and then they can very quickly agree with it, disagree with it. That feedback goes back to the system to make it even better, and then get the right diagnosis and treatment recommendation for that patient as fast as possible, like like the first time they sit down. So sort of a diagnostic odyssey that might take a month can now be done within like 30 seconds. And I think that's where we're headed on the clinical side, and we're like only at the very beginning. Like that, everything I described, there are pieces of it exist, but like that whole system doesn't yet exist.
And as you're building the system, and you mentioned before, you also consider yourself kind of like a pathology infrastructure. It's more than just like a product; it's actually like a whole system, right? To support the workflow.
Yeah.
How much do you balance leveraging current infrastructure versus requiring new technological competencies, right? If you think about, you can innovate on the features, something that are more like routine innovation. You can innovate obviously in the business model and be more of the disruptor in that space. But if we think about architecture, are we talking about architectural changes that are going to be harder to adopt at hospital systems, or do you
Yep.
fit mostly into the workflow that's currently there?
Yeah. So first, we try as hard as we can to fit into the workflow that's already there. I mean, I think that's one of the beauties of the platform. The biggest change is they have to, if they go from microscope to digital for their method of primary sign out, they still have to make the glass slides. They have to also buy some number of these whole side imaging systems, which are these big scanners. You could picture like a radiology scanner, but there's a pathology scanner. We don't do that. That's the biggest change in workflow that has to happen prior to us. That is a big change, but it is just absolutely required. But once, and we don't manufacture or sell those ourselves, but once those are in place, yeah, we have a web-based platform. So the actual technical integration, there is an important piece of integration with the laboratory information system, but that's kind of it. So like everything else happens in the cloud, and it's a SaaS type model that we can manage and make changes and do not have to push any of that to the IT systems of our users. Some folks still want to store data on-prem, which we totally support. So we can have kind of a hybrid on-prem cloud model. But in terms of like any kind of purchase for us, hardware or local stuff, we've very much moved away from that. The other thing is you may talk to a lot of innovative diagnostic companies who have like some totally new technology that requires a whole disruption of the workflow or transformation. We absolutely have not done that. We're using these stains that have been around for 150 years, glass slides have been around for 150 years, and then the scanners are new. But we want to maintain all of that, and then yeah, everything else happens in the cloud, and we on a daily basis have to make sort of build versus buy decisions because we really want the tailwind of these tens of billions of dollars or trillions of dollars that are being invested in cloud and AI architectures, and there's this humongous set of resources and open source tools and even paid services by AWS and Google and Microsoft that are available on the cloud. So we want to innovate where like we're the only person doing it, or maybe there's us and two other companies doing it, and leverage and kind of stand on the shoulders of all these huge tech giants that are investing heavily in infrastructure for very, very similar problems, which is how do we do AI on big heterogeneous multimodal data sets?
Perfect. So, Andy, you've been very generous with your time. So, if I can ask you one more time, or one more question, really zooming out, if let's say PathAI is wildly successful, what does the future of diagnostics look like? What does it mean for patients, clinicians, and how we think about disease?
Yeah, so the biggest thing for patients that I really think is very clear is if you know of any your loved ones or yourself have any experience with like a complex diagnosis from pathology today, it really is not in a good space. I mean, and I'm saying this as a pathologist who's spent my career working with pathologists. It's often slow. You often get variable opinions. If you send a difficult skin biopsy to 5 pathologists, you can ask any dermatopathologist, you're gonna get, like, 3 different answers. They're gonna be sort of ambiguous. It's often not data driven, it's just someone interprets an image this way, someone else interprets an image a different way. Um, and getting second opinions is difficult if the labs aren't digital yet. You actually have to ask for the glass slides, and they're sent to you, and then you have it's like the whole thing takes months and is very slow. So I'd say it's almost like you really have to describe the problem today to then say what I'm going to then describe as the future as being significant improvement. But you can imagine in the not too distant future, every patient or almost every patient in the world, let's say every patient in the US, when it'll take some time to distribute these, can be far more confident that they're going to be getting the right diagnosis as fast as possible. And it will be tied to the right therapeutic recommendation. And that, we basically have the core technologies today, I think, that will get us there. And it's a matter of sort of building the products and platforms around them to enable that, where every new slide is read first by an AI system and that's standardized. And the pathologist's job really evolves to, counseling other physicians, potentially counseling patients, but sort of having trust in the core underlying diagnostic data so that we're having fewer errors, having significantly improved turnaround time, and, patients can be much more confident they're getting the right diagnosis and the right treatment recommendation. And, I feel like that's our area of focus. And then that becomes like the scientific bedrock for clinical care, but also for drug development. And, if that happens, I'd say PathAI would have been wildly successful. And of course, there's still a ton of work to do on therapeutic development and improving, cancer cure rates and things that I hope this technology helps advance. But that's like our core focus.
That sounds like an extraordinary future, extraordinary vision, and I wish you the best of luck, Andy. Thank you so much for your time and for being on this episode. I look forward to meeting you at the World Medical Innovation Forum later on this year.
Thank you. Thanks for having me.
That was Dr. Andy Beck. Now, unnatural signals.
This conversation shows us what happens when trust becomes a strategy. Here's what we're archiving. Accuracy is the foundation. Competitive advantage starts with fewer errors and faster answers. Improvement can't stop. Systems and institutions have to get better continuously, not occasionally. Human expertise evolves. As machines handle pattern recognition, humans shift toward judgment, guidance, and care. This is how tools change roles without erasing them.
Thanks for listening to Unnatural Selection. If you enjoyed the episode, subscribe, leave a review, and share it with someone shaping the future. Explore more at unnaturalselection.net and connect with us on LinkedIn and Facebook. Until next time, keep evolving.